Dr. Therian here, and if you're watching this video, it's likely we just finished talking about a corneal ulcer during your eye exam. Now understand this video is just to reinforce what we talked about. It doesn't take the place of the need for an eye exam or anything along those lines. And so what happened is probably overslept in the contact lenses, or the contact lenses were just overridden with some bacteria, and taking them out, putting them in, something along those lines, you scratch that eye and lo and behold, now we have a little infection that kind of sets in. Corneal ulcers, we kind of grade them from a few different areas, a few different thought processes. One is how close to the visual axis is what we call it. How close to the center of that pupil is where we're having to look through it. If it's way over towards the white of the eye, it's less scary from an eye doctor's standpoint. The more central it is, the more concerned we are about that corneal ulcer. The other thing that we look at is the size of it. You know, how big is it? Is it 1 millimeter in diameter? Is it 3 millimeters in diameter? That size plays a real big part also in how we're going to manage it and how we're going to treat it, just like the location does. And then how many are there? You know, if there's just one, nothing to get too excited about. If there's 2, 3, maybe even 4, now we're starting to be a little more concerned about other things and, you know, treatment options that are available to us. And so, you know, if it's just one small little corneal ulcer up underneath the upper eyelid, kind of close to the white of the eye, 1.5 millimeters in size, I'll put you on a little steroid antibiotic combination drop more than likely. You'll do it for about a week or so, and it'll be right as rain in just a little while. If it's a bigger one, or if it's closer to that visual axis, then I may want to put you on an antibiotic, pretty heavy, and then pull you back into the clinic in a couple of days just to see how it's doing, see if it's healed up, and then see if I can get you on that steroid antibiotic combination drop. The reason I want on that steroid antibiotic combination drop as quick as possible is that slows the healing down a little bit, but it also slows and decreases the risk of scar tissue. It gets rid of that inflammation in the area, and so it'll help decrease the likelihood of a scar, because if we end up with a scar in the central part of our vision, we don't see real good through scars. So we don't want that. That's kind of the thing that we worry for and watch out for. And so from a patient standpoint, things to kind of watch out for is if this is getting worse. You know, if I give you the drops today, tonight it's probably going to feel maybe a little better, about the same, but tomorrow it should start to feel better. 2 days it should be really good. 3 days we should be almost out of the woods, feeling pretty much all the way better. If we're not having that stair step of, hey, it's a little bit better, a little bit of improvement as we're going, then need to hear about it, because I may need to change versions of antibiotics and get you on something that's more broad spectrum or more specialized to attack a specific type of bug, specific type of bacteria. And so again, should start to improve things. What you want to do is, you know, check that eye. If the ulcer's over here, cover up your left one, see if the vision's improving or getting any different. Pay attention to your pain. Those types of things will keep a good eye on stuff. And so, as always, this video doesn't replace the need for an eye exam. If this stuff is getting worse, you definitely want to take it serious, because there are some bacteria that can chew all the way through the cornea in 24 to 48 hours. And so we want to make sure that it's, you know, nothing that's going to cause any problems. So make sure that if you're having one of these going on, you've been looked at by a competent provider. And then, you know, this doesn't take that place of that competent provider. And then if you have any questions, we're always here to help.